Hello everyone, my name is Marlene. Thank you for joining me. In this short presentation, I will be talking about understanding pulmonary function tests in detecting reduced lung compliance in obstructive sleep apnea patients. Throughout this presentation, I'll give an overview of how pulmonary function tests, or PFTs, relate to OSA, and also touch on what my recent survey results reveal upon awareness and understanding of this topic among healthcare professionals. Let's take a quick look at what obstructive sleep apnea actually is. OSA, as they call it, happens when the muscles in the upper airways relax too much during sleep. This causes the airways to narrow or close, which interrupts normal sleep breathing. People with OSA often experience snoring, pauses in breathing, and low oxygen levels while they sleep. Over time, repeated airway obstruction can cause stress on the lungs and cardiovascular system. While OSA itself mainly affects airflow in the upper airways, long-term effects like low oxygen levels, obesity, or inflammation can eventually make the lungs less elastic, meaning reduced compliance. So even though OSA is an obstructive condition, the reduced compliance that can develop over time gives us a reason to look closer at pulmonary function tests. Now let's take a look at pulmonary function tests, or PFTs. These are really helpful for measuring how well our lungs are working. They give us information about how volumes, airflow, and how efficiently gases like oxygen and carbon dioxide move in and out of the lungs. A few key parts of PFT include TLC, which is total lung capacity. This tells us the total amount of air the lungs can hold. There's also FVC, forced volume capacity. That's the amount of air every person can blow out of after taking a deep breath. RV, residual volume, which is the air that stays in the lungs even after exhaling, and DLCO, which measures how well gases move from the lungs into the blood. These results can tell us a lot about changes in the lungs' elasticity and compliance for example, when someone's FVC or DLCO is lower than is suggested, the lungs are getting stiffer and not expanding as easily, which means reduced compliance. In patients with obstructive sleep apnea, these tests can be really helpful for detecting early signs of reduced elasticity, especially when OSA is combined with things like obesity or long-term inflammation. Here's a graph that compares compliance in normal lungs, COPD, and fibrosis, so that you could see visually how reduced compliance looks like and how it can relate to OSA over time. Now let's go over the results of my survey. Out of the 14 participants, 100% said they were familiar with pulmonary function tests, so awareness of PFT is definitely high. But when I asked if they believe that obstructive sleep apnea can reduce lung compliance, only 71% agreed. The rest were either unsure or disagree. This shows that there is still some uncertainty about how PFT results are related to OSA. The survey also revealed a few key barriers. They make it harder to use PFT effectively with OSA patients. So let's take a closer look at these barriers. The top 3 challenges when it comes to using PFTs for patients with OSA were: first, lack of knowledge about how to interpret the results. Second, limited access to testing equipment or resources. And third, time constraints in basic clinical settings. These barriers are pretty common, especially in respiratory care, where time and staffing can be tight. What they show is that the issue isn't just awareness, it's also about confidence and access. This tells us that more focus on education and hands-on training could really make a difference in helping clinicians understand and apply PFT more effectively. Therefore, improving provider confidence with PFTs is one of the important steps in closing the gap between knowledge and practice.